I guess to begin with, so my background, the first half of my career was spent in mental health. I worked for Southwest Behavioral Health for about 12 years as a licensed clinical worker. My main clientele was actually adults who were severely chronically mentally ill with diagnoses like bipolar, schizophrenia, mood disorder, psychosis, that type of a thing. I think I ended up getting a lot more comfortable with that population than what we would call normies. There was something about those folks that dealing with that kind of stress and surviving that type of thing and having some degree of recovery, I gained a lot of respect for those people. About 17 years ago, I switched career paths and came into public health. The whole reason we teach this as part of not only the Medical Reserve Corps, but also CERT that was mentioned earlier. Those trainings have a required component of psychological first aid, because we find more and more that after an emergency or disaster, the mental health needs sometimes outweigh the physical needs. And so once you triage and take care of, those immediate first aid injury needs, life or death situations, they have found with the World Health Organization, if they set up aid stations around the world, whether it's following an earthquake or a tsunami or even war, that a lot of the complaints or a lot of things they have ended up handling over the years have to do with emotional health and resilience. And so that's one reason it's really good to become familiar with this concept of psychological first aid. I wanted to, first of all, going into this, define what trauma is. And so in my household, I've got 8 kids. Most of them have gone into or going into psychology or healthcare. My dad was a therapist. My mom was an early intervention worker. My wife and I met at Southern Utah University as psychology majors. And so our family discussions can get pretty nerdy. And one of the controversies is what actually is trauma. And so trauma is a word that's thrown around a lot these days. And a lot of times it's easy to say, even lightheartedly, this happened to me. I think I have PTSD, which is post-traumatic stress disorder. It's a genuine mental health diagnosis. But when we talk about trauma-informed treatment and children's trauma, trauma is not by definition anything negative that happens to you. It's actually a lot more specific than that. And my one son, who's going into a doctorate in psychology, again, will get very heated about this, saying we have to make sure we understand, especially in the professions that you guys are in this volunteer capacity, what it is. So true trauma, according to definition, is to either experience or be a firsthand witness to death or threat of death, where you think you're going to die or think someone else is going to die, serious injury, or sexual assault. So it's a lot more narrow than we say today. So can you have lingering issues that need to be dealt with and processed after negative events? Of course, outside of this. But when you're really talking about true clinical trauma, it's pretty specific to these things that really are some of the worst things that can happen to people. Now, on one hand, life is full of these type of experiences, either happening to you or somebody else. It's kind of hard to get through life without brushing up against some actual trauma. On the other hand, humans are remarkably resilient. And if they're not, there's now more than ever before, there are professional services that help people heal and get through that process of trauma. So that's what I wanted to start off with here, of defining what trauma actually is. So there are 2 ways that trauma is currently defined psychologically. Number one is an acute stress disorder. And that are specific behaviors that last anywhere between 3 to 30 days after a traumatic event, and they fade. It's not uncommon. And it's also, the reason it says 3 to 30 days is a lot of time you're not going to experience the effects of a traumatic event until after a couple of days. And then you start to feel things like sleeplessness, loss of appetite, irritability, memory lapses, flashbacks, nightmares. That's actually pretty normal as your body starts to process those things. And it's also pretty normal that after a couple weeks to 4 weeks, that fades away and you're back to normal, whatever your baseline functioning is. So that's acute stress disorder. That's how it's defined. Sometimes it would be a little surprising if you didn't have some of those symptoms. On the other hand, a lot of people think, this is not who I normally am I going crazy? And my rule that if you have to ask if you're going crazy, you're probably all right. It's when you're saying everyone else is crazy that there's a problem. So sometimes it takes a lot of reassuring people that there are normal reactions to something traumatic that happens to you, that things are going to be okay, those things will pass, and that comfort can be offered during those times. Now, post-traumatic stress disorder, or PTSD, is a little bit differently. This diagnosis actually became more defined and put in the Diagnostic Statistical Manual, where we diagnose these things following the Vietnam War. Before Vietnam War, PTSD was called something else after World War I and II. Does anyone happen to know what it used to be called? Shell shock. Yeah. So shell shock was basically this definition of people who seem to be maybe dissociated a little bit, having certain symptoms occur because of not only the physical, but the mental stresses of being in a battle situation, of a constant life and death thing. So they define that further to be post-traumatic stress disorder. And that's when the symptoms of stress disorder last longer than a month and sometimes can have a delayed onset. Sometimes you can go 6 months doing pretty well, and then it starts to hit. And that's normal. We're not sure why that happens, but that's how our brains and our bodies work, sometimes making sure you're on safe ground before you start to process it. Yes, there's a question back here. Suze, if you can use the mic.
Years later?
Yes. So the question was, can that come on years later? Yes. So delayed onset 6+ months. So it can be months or years. In fact, a very common scenario is in my clinical practice when I would meet, say, a typical situation where a young woman would come to me, college age, saying, I've been doing really well. I'm working, I'm in college, I'm in a relationship, but all of a sudden I'm processing an abuse situation that happened when I was younger that I thought I was over. And now I'm struggling with sleep, with my schoolwork, and that I found that to be so normal, expected. The pattern is that my theory is that once a child has experienced trauma, when they reach adulthood, where they realize they can actually protect and take care of themselves now, and they're in a safe position, then their mind relaxes a little bit and says, okay, it's time to process this and remember and deal with this thing that happened to you before. So yes, 10, 20 years later, you can experience that definitely. And it helps to reassure people that, again, that is normal. That's in some ways how the body and mind protects itself. It's almost like telling you, okay, you're ready to deal with this now, whether you want to or not. And so again, a lot of those symptoms can be flashbacks, feeling like you're in that situation again, a lot of physical symptoms like loss of appetite, stress, muscle pain, gastrointestinal disturbances, sleep disturbances, and then just things that make a person feel worrisome, like why now? I thought I was over this. And again, that's pretty normal. That's one of the patterns of how we deal with actual trauma. So that's a great question that, yes, it can be delayed 6 months or even years later as far as PTSD. So the treatment for acute stress disorder and PTSD, what they're finding now is that the sooner a person can feel grounded and safe and able to tell their story, the less likely it is that they will develop PTSD. So here are some findings. Number one, psychological first aid, which really is just a few principles that we'll talk about here in a minute. If that's employed, even though it's so simple, that can make a huge difference later on. If needed, then cognitive behavioral therapy, or CBT, is effective if they continue having problems after a month or if it comes up later. CBT in the world of psychology is one of the few time-proven evidence-based practices. The concept behind it really is convincing it or helping a person realize that they actually have power and control over their thoughts and feelings. You'd think that that would be simple, but a lot of us being human, our feelings and our thoughts are incredibly strong, and they can show up as reality. And so helping a person go through therapy to help them realize, oh, there's certain things I can do that can raise or lower emotions or my thoughts and feelings, and that loosens things up and actually helps them move forward. So CBT is been around for decades. That's a wonderful therapy that can be applied to trauma if they're not recovering on their own. What's not recommended, this is interesting, is psychological debriefing. Now, those of you in the emergency response fields, a lot of times, if say you're on a rescue squad, ambulance, fire, police, military, sometimes they will have a debriefing session right after that goes over the details and kind of checks in with everybody.
Yes, we used to do that in the hospital after a code, especially if it wasn't a successful one. And also something in ER, if a child died or something like that, we would do that immediately afterwards with the staff.
Yeah, similarly, when I was working like at a long-term care center, if we had, a code incident, we would do a debriefing afterwards just to talk about, what could have been done better, make sure everyone is feeling okay.
Yeah, we've done it. I've worn multiple hats, fire and air search and rescue, things like that. So we did the same thing when we lost patients. And again, folks need to remember, if you're on a CPR call, the patient's already passed. You didn't do it. You're trying to save and revive somebody. You didn't lose the patient. We've also unfortunately had to do it in our own crews when we've lost somebody. And again, it really does help to have somebody come to a discussion, and then we bring it up again later, a month, couple months later. Always have help, let them know who to go talk to, that sort of thing.
Kudos go out to all of you who have done that before or are still doing it. I remember when I used to work at Cedar City Hospital in their crisis services and social work, They would call me in, say there was an accident with a couple fatalities that involved families. As I would meet with them, then there was the ambulance and highway patrol crews that would come in, and they were doing the physical cleanup and then initial trauma. And we'd often both say the same thing to each other: I don't know how you do what you do. And so certain personality types become just something where it's like, it's okay. I actually thrive and do okay. I do my best work under these conditions. And that shows kind of just the variety of how we work. And kind of that mutual respect goes out. So what they have found, the World Health Organization actually has issued a warning now almost 20 years ago that in the general public, the debriefing method is ineffective and sometimes even harmful. Because again, if it's in a professional setting, you know each other, you deal with things kind of the same way. You guys have mentioned that sometimes they would bring an outside person in to run that debriefing. The first one I sat in, that's how they did it. And I did detect that attitude of like, well, who are you? Because you sort of have your tribe. And so it's really what is perceived to be a crisis or trauma has a lot to do with how it affects you emotionally and mentally. So yeah, just thought I'd bring that up. Professional debriefing is still in practice in some ways. As far as the general public, what you're doing is sitting them down and going through this process that most people are not ready to handle and have a different support system than you would say on an ambulance team or a military squad. So this is interesting. Following the 9/11 attacks in 2001, they thought, okay, this is going to be a big deal helping. So thousands of counselors were mobilized, ready to meet the mental health needs. A lot of funding was set aside, but $90 million remained unspent as far as available mental health resources. So number one, I'm glad that we were at a point at that time where we recognized, let's get ready to pick up the pieces, not only physically, but emotionally. But this also is a testament to general human resiliency and how we respond to trauma. So being up close or in that situation of the terrorist attacks with the World Trade Center or the Pentagon or the airplane crash, would that define the true definition of trauma? It would, because you are witnessing death and destruction, or you're thinking, am I going to make it? That is true trauma, where it realigns what your paradigm is of how safe life is. But what they found is that actual trauma, when it occurs, 75% of people who go through an actual traumatic event will not experience long-term distress, nothing more than that acute stress disorder. 10% experience chronic psychological problems like PTSD. So that's actually encouraging. It's not to downgrade the effect that trauma can have on us. And sometimes you don't know how a trauma is going to affect you until it happens. And sometimes, like Chris brought up, maybe years later, it hits you and you're like, where did that come from? So really, it's personal experience. But generally, most people experience an actual real trauma, recover as humans do after a little period of realignment, having a good support system, getting back to a normal routine, and finding purpose again. So now we get into what this topic is all about with psychological first aid, or PFA. This is a disaster relief technique that was designed specifically to reduce PTSD, and it was developed by the VA in 2006. A lot of our really good science and even in behavioral science comes out of the VA and the military, because you're actually signing up to do a job that is likely going to involve trauma. You're almost inviting that. And what they've found over and over again, especially veterans returning from a battle or high stress situation, there are higher rates of suicide and mental health disorders. It's taken a little bit to kind of catch up to that, but that's being recognized more than ever. PFA has been around again for about 20 years. Principles are, first of all, what it's not therapy or debriefing. And so you don't have to be a therapist. You don't have to have any training other than a training like today, which is very similar to basic first aid training for physical injuries. It's not therapy. It's not the professional debriefing. Anyone can implement it. And it really consists of look, listen, and link. So you're looking, you're assessing the situation. That's kind of triage. Listen, you're hearing, connecting with the person, hearing their experience. You're lending them your stability. And then to link, getting them back to their natural support system as soon as possible. That's really what it is. And so the rest of the training really is just elaborating on those principles and going over them so that you feel comfortable about it. And finally, we add this on there as self-care. So even though you and your professions maybe have been exposed to these kind of events and helped before, there is an element of self-care and making sure that you protect yourself against what we sometimes call secondhand trauma, or sometimes we go, we thrive on stress and sometimes forget how to live a normal life. Again, a great illustration is guys coming back from a wartime situation. The way that our world is now with fast travel and reintegration, I mean, a person could realistically be on the battlefield, being shot at, seeing their buddies killed or injured, shooting at other people, having to deal with that whole thing of life and death, and within 24 hours, be back in safety, and then pretty soon be back in their home and back to a job where society around them is not what they were just used to doing. It can take time to de-escalate from that. And that's why a lot of times they will notice that someone coming out of there will be easily startled by certain noises or sounds because they're still in fight or flight survival situation back in an environment that doesn't require that. So it stands out as odd, whereas that was how they were surviving just a few days before. So going a little bit more into those three categories: assessment or triage. Those of you in emergency response and medical know all about triage, the different colored tarps, right? I think I went to a drill a couple of years ago over at the hospital where he had the colors of tarps. And now I'm trying to remember what they meant. I just remembered that if you're on a certain color of tarp, maybe roll over to the other color if you want to get treated better. That's all I remember from. I need to go back and see what the colors were so I don't mess it up. But when it comes to emotional and mental health, the triage is, okay, number one, are any life or death situations stabilized or taken care of? That first aid physically comes first. Are people breathing? Do they have a heartbeat? Is their airway unobstructed? But then it's to what's next. So are there uninjured people? Mobilize them to either evacuate or become useful. And some of you probably know this, that uninjured people on a disaster and emergency scene can sometimes be a hindrance, right? They can sometimes do the wrong thing or want to help but maybe not be trained. And so it's important to get the uninjured focused, either evacuating, leaving, or focused doing something at least that will keep them out of the way of helping people who are having a hard time. So then what you're doing is you're listening, trying to gauge the emotional state. So let's say you come up on a car accident. There are people who've pulled up, they're trying to help, that are uninjured. Maybe there's a couple of people in the car that were thrown out but are still okay. Maybe there's someone who's unconscious or maybe even dead, and say their spouse or parent is right there. That's your target, where they're falling apart, they're in shock. And so you mobilize the uninjured, give immediate first aid where it's needed. But then you find those people that are really struggling, that are having the immediate effects of the trauma, and just helping them ground, just listen to them. There's nothing right. There's no perfect thing to say to them. There are a few things we'll mention that probably don't help. But my reassurance is I probably said all of those unuseful things when doing crisis work. They're probably not going to remember. So that's important to think as well. So what you're doing is you're a stable person that's not immediately emotional affected. You're lending them your stability and then trying to get them connected with their natural support system as soon as possible. And that's what linking is all about. So again, psychological first aid it's not only for professionals, it's not professional counseling or therapy. It's not encouraging them to process the event, because people generally will do that when they're ready. So that's why professional debriefing is okay in that setting. The general public, you don't want to encourage anything. You just let them take the lead. Some people will want to talk about it right away. Other people will be very silent. Some will be angry. Some will be sad. Some will be in denial. You're just lending them your physical presence, which also is emotional, until you got them back with their support system. The only details you want to press for maybe are, hey, can you tell me your name? Or maybe you're wanting a phone number to try to call a family member. And don't try to get their feelings or reactions. Those things will all come up, but it may be on their own time in a safer setting, or it may be later. So we've talked about what psychological first aid is. It's good to know what are the phases of a disaster and when do you implement psychological first aid. So there's the initial phase. That's when it happens. So that's when the bomb goes off. That's when the earthquake occurs. That's when the shooting is taking place. Those are the things that we don't expect. We have very little or no control over. It's when it happens and in the immediate aftermath. The intermediate phase is things you actually do have some control over. So that's when you're taking inventory. That's when first response and rescue units are called. Now, we call first responders professionally that for a reason. They're the guys and the women that show up, that have the training, and the lights are on and you feel like, okay, I'm in good hands. But really, who are the first responders? It's whoever's there or gets there first. That can be anybody, whether you're professionally trained or not. And so that's why it's important to, even for the general public sometimes, to know these principles, because you may be there on site or arrive and maybe be minutes or even an hour or two before the professional first responders get there. The recovery phase is the reconnection, return to normalcy, and that can again take anywhere from days to years. Things that induce trauma, we've already defined it with number one, the actual or potential death to yourself or somebody else. Then there are the sensory horrors. We are sensory people, and so we see, smell, and hear things. There can be things that are very out of the ordinary. So those of you who've had a major injury or seen one, you're like, hey, blood's not supposed to come out like that, or arms aren't supposed to be bent like that, right? So things that are out of the normal range of what we expect are horrific to us. That's the definition of horror, is something is not the way it's supposed to be, or put together the way it is. And most of us are sensitive to that. Having your home or neighborhood destroyed. So even if you're not injured at all, having your house burned down or destroyed in an earthquake, or having your neighborhood cordoned off for a while or flooded, we take for granted sometimes what we're familiar with. Our home, our house, so you've been there maybe for years, for some people their whole lives, and to have that very suddenly look different or be gone, that can be pretty traumatic, especially sometimes for kids. Sue's question back here. Yeah, so he mentioned the fires in LA. If you see the pictures of that, these beautiful beachside neighborhoods, and just flattened desolation, right? Just rubble. And so it can even be your house is fine, the house around you is gone or different. That can be disruptive. And so sometimes even that could be traumatic, where it's not you, but you witnessed or it got close to where you were. What the whole thing does is it rocks your sense of what is safe in the world. But generally, most of the time, life's fortunately pretty mundane and boring. Finally, loss of contact with family and friends. So during Hurricane Katrina, if you remember, there were large-scale evacuations. They were just trying to get people out of there as soon as possible. And so sometimes families were separated, put on buses, and taken states away sometimes. In Utah, we even saw some refugees from Hurricane Katrina. And what happened is, if you're a school kid and suddenly you're thrown on a bus and taken to Texas, everything is different. You're not home. Where's your family? You've got parents. Have any of you ever lost track of a kid? Panic of where are they? Are they okay? Imagine having that go on for a day, 2 weeks, a month. It took them sometimes a little bit to make those connections and reunite them. So that can be traumatic as well. Everyone's okay, but you're not at home anymore and you don't know where your support system is. And so the reuniting that's why that's so essential to do it as soon as possible. So here are some predictors. We touched on this a little bit. How are you going to react to stress? Some people actually do better work under stress, or that's sometimes when they focus. So it depends on your prior experience, how much it disrupts your life, the time interval. So how much time has elapsed between prior incidences and then this incident. You've heard of unfortunate people who maybe they had a death in the family, then the next week they get in a car accident. Maybe the next week they lose their job, and you're like, holy cow, this, that's really unfortunate. But sometimes it's the straw that breaks the camel's back. If we have enough recovery time, normal resilience kicks in. But if you have a bunch of things happen at once, that can sometimes overwhelm even the most resilient person. What is your current emotional and mental resilience? Most of us might think, well, I'm doing pretty good. So there's the saying that, does it create character or does it reveal character? And I don't know if there's a right answer to that. And so sometimes we don't know how resilient we are until something happens. Or we might know, because of how we reacted in the past, we have a pretty good idea of how we would react if something unexpected and traumatic came up. And then finally, what does trauma mean to you? So with your culture, with your spiritual beliefs, actual trauma impacts all parts of who you are, how you think with your cognitive abilities, how you feel, how you react physically in your body, and also your relationships. If you're put into those stressful situations, time can seem agonizingly slow. We've also heard people say that if things are happening in the moment, it almost seems like they're moving in slow motion. Other people feel like they're on the outside looking in, where they're watching the situation. Trauma can do very interesting cognitive things. The way the human mind protects itself and operates is pretty fascinating. There's the finding that I like to quote a lot of, percentage-wise, how humans react to a sudden trauma, a sudden emergency that maybe puts your life in danger. There are 3 reactions. So if you're presented with a life or death situation, what are those human reactions? Fight, flight, or freeze. And I hadn't heard about the freeze one until I worked here and was doing some research on this. Fight or flight is very commonly known. That's an instinctual animal behavior that if you're presented with danger, you either want to get out of there as soon as possible, which is probably the best option because you're least likely to have to confront, or you stand and you fight and physically grapple with or handle whatever situation is in front of you. And then there's freeze. Interestingly enough, studies have found that most humans freeze. 70% is the estimated finding of humans that will actually freeze, and maybe that has to do with the time determination. Reaction doesn't necessarily make a lot of sense biologically unless you look at some animals where they freeze or hold still. Sometimes they might be left alone or not be noticed, or they're not going to do anything dynamically that's going to change the situation. So there probably are some reasons. So most of us instinctively will actually freeze. 15% will panic and do something inappropriate, the next wrong thing. Jump out of a window, start a stampede, react instead of drop cover and hold on an earthquake, stand up, run around and wave their arms. And then the last 15% will actually take immediate appropriate action and do the next right thing. Those are the type of people I've noticed naturally find themselves into emergency response careers and professions where they think better under pressure. It clicks for them. And thank goodness we have those types of folks. I believe you can actually train yourself and lean into some of those things. If you know that you panic or freeze, you can actually do things of practicing or drilling or muscle memory that makes it more likely that you will make the next right decision. That's one advantage of doing drills and practice. And emotional impacts of trauma can be all over the map. I've seen people become almost flat affect or in their denial. I've seen people laugh inappropriately, scream with anger, weep. That really just depends on the impact on that person. Physical impacts of trauma, especially residual, we've talked already about how that affects your body and how it expresses. A little exercise on that is think right now, if you're feeling a little stress right now or tension, or if you do feel stress or tension, where do you feel it in your body? Everyone point right now, is there a certain place where you tend to feel stress or tension? So a lot of you are doing this. Nathan's doing stretches to relieve his stress in real time. This is really cool. Your physical body will manifest, and sometimes whether you want it to or not. A lot of times physical issues, even lowered immunity, will tell you you're under too much chronic stress and it's time to relax and do things like get more exercise, relax, get better sleep. So yeah, typically shoulders and neck, a lot of people feel gastrointestinal tightness in their heart, discomfort, where a lot of times people present to the ER saying, I feel like I'm having a heart attack. They'll do the testing and say, your heart's fine. You're actually having anxiety. And that can almost be humiliating to someone in disbelief. Well, how can I have such a strong physical reaction to stress? Well, our bodies are pretty amazing. They can manifest themselves very physically in response to trauma. Interpersonal, this really comes to light with folks in the professions we've talked about, military, law enforcement, of trying to relate to the normal world of people who maybe don't enjoy being under stress a lot or look at life a little bit differently. That's why I've noticed in the past few years, the VA military's put a lot more attention on family reunification when someone comes off a tour, sometimes offering or sometimes mandating initial therapy to try to make sure that there aren't any problems or issues. The police department in Cedar City mandates one therapy session a year for all their staff, whether they want to or not. It's on your performance plan. What it is a check-in. It's a screening. How are you doing generally? If they're fine, great. They just got an hour where they sat in front of a therapist, not in their squad car. But it can pick up people that, my marriage is fraying around the edges. We're arguing a lot more, or maybe we're sleeping in separate rooms, or I'm noticing I'm having a lot of, stress-like reaction symptoms, and it's becoming a lot more acceptable because typically in that field, to admit those things feels like you're admitting weakness, and you're not going to be a strong part of the team. And so there's a wariness of some people to even mention that because they want to keep their job, right? But the stigma is lowering a lot, I think, in those type of things. This is a whole list of stress reactions physically and emotionally. These are all very normal. So sometimes if people are experiencing these and they're continuing for more than a couple weeks, that's when you might hear them say, I feel like I'm going crazy. This isn't me. Am I ever going to get better? You can safely and statistically tell that person, look, chances are that this is going to fade. Give it a couple more weeks. You're going to be okay. What do you need right now? Encouraging people to take good care of themselves. It would be weird if you didn't have quite a few of these if you underwent a traumatic event.
This isn't a bomb and it's not a bullet, but my 2-year-old, she's 2 and 3 months, was stung by a bee, a bumblebee, and she screamed bloody murder, and she is now, like a week later, still, she will not go outside without covering her head. And I think that her parents, they comforted her, but they looked all over her head and they denied that this happened to her. They said, no, you weren't stung. We don't see anything. But she was obviously in pain and stung. And so now she's having this fear of recurrence. This isn't all these other things, but it's trauma to her. And it's a week later, and she still isn't going to go outside without covering her head or having something over her head. So what would you say? This is trauma to her.
Right in the middle of it.
Yeah. So now what do you do?
Yeah. So it's traumatic to her because in her mind, she was in physical danger and felt some kind of physical pain. And to her, in her mind, a bee can be a deadly, dangerous experience, right? And so to her, that by definition, it probably was traumatic, but she's right in the middle of it. And so if I were to tell her parents something, I would say, comfort her. Don't give in overly to the behavior and give it another couple weeks. And gradually you'll see them start going outside. Now, let's say a month goes by and it's still the same intensity of covering her head or not wanting to go out. Then sometimes it's okay to start looking at, encouraging them or modeling for them or trying exposure. Well, let's go sit on the porch for a little bit, or distraction. If it goes on for months where it's like dysfunctional, we can't get her to go out and play with friends anymore, then that's where you would tend to look for maybe a therapist or someone that is good with kids. Chances are in a couple weeks she'll get better again. Now, as part of reassurance, so I have a a daughter who was kind of born high strung. So some of us, that's just part of our personalities, right? That's just kind of our baseline. She had a helium balloon once, and as we were leaving the store, wind came up and blew the balloon away. And to me, it was like, oh, well, that's too bad. Get in the car. And she was really stricken. That balloon had taken it away. And to her, the wind could take away things. And so for the next few days, if it got windy, she would grab her pigtails, hold on to them, and run in the house. After a couple of weeks, we'd be sitting in the backyard, a wind would come up, and she'd start grabbing toys and throwing them in the door. Save everything, the wind's going to get it. And so what we did is we kind of ignored her. We didn't go running in with her. You don't ever want to join the delusion, right? You want to support them, make them feel supported. We made the choice to kind of relax and show that we weren't getting blown away outside, because eventually the cognitive is going to catch up and start proving to her, oh, the wind might blow some things away, but not me or my toy or my mom or dad, even though she maybe wanted it to sometimes. And so, yeah, now that anxiety and that experience was imprinted on her. In fact, she's an adult now and a mom, and we'll kind of laugh, and she'll laugh nervously about that. Had a big impact. The wind blowing away a balloon to her, she still remembers that, and it can bring up a little discomfort, but she's 90% recovered, where it wouldn't be considered PTSD. That may be kind of we have certain on our timeline, if we're to put dots on our lives that something happened that really had an impact, no matter what anyone else thinks, that may show up as one of those for that kid. But more than likely, it will fade statistically over the next couple of weeks, sometimes even after a month or two. Even seeing lowered behavior is promising. Okay, going back to psychological first aid, you're looking with the triage, listening and helping them ground, and then linking with their support system. Here are some do's and don'ts. And again, I've done all the don'ts. That's why they're on there. And I hopefully they survived. So what you want to do is you want to sit facing the person that's struggling emotionally and make good eye contact. Now, once in a while, you'll have someone that doesn't want to make eye contact, but initially you want to offer that and make good eye contact. Then it's up to them if they want to turn or look away. Be prepared. Affected people may do all kinds of things. They may want to hug and grab onto you. Now, in graduate school, I was brought up, if you're in a therapy session, no touchy, right? We don't touch people. Why? Because we've swung too far one way. This was years ago, of fears of being misinterpreted or sexual abuse and things like that. What we did, though, is we blocked off that very normal human contact that, if safely offered, can be very valuable for someone like a teacher or a nurse or a healthcare provider. And so to me, it's moderation. We're all grown-ups, and if someone grabs onto you in desperation, are you going to say, oh, we don't hug here? In the moment, just be prepared. If you're offering psychological first aid, just like physical first aid, it can be messy sometimes. So be prepared for all kinds of reactions. You want to make sure you speak clearly and be an active listener. My wife has said, for being a therapist, I'm not a very good listener. What that means is that you're nodding, you're doing things that make them feel like you're listening to them. You want to deal with their immediate needs. So when I used to work in the ER, I found out really quickly where the tissues were kept, the warm blankets, the drinking water, because offering physical comforts like that pays off emotionally. So even though my job wasn't to suture them or stop bleeding or prescribe medications, I could come in once they were stabilized and put a warm blanket around them. Or if they were weeping or sniffling, I could bring Kleenex. That act alone, providing comfort or giving them a drink of water, that has big payoffs. So don't underestimate those small comfort things that actually have a lot of psychological benefit. There's something, by the way, if someone's in immediate trauma and kind of having a breakdown, so to speak, or trying to get control of themselves, if you can get them to swallow water, that signals to the body that there's not a life or death danger anymore. Because when you're in that fight or flight, your throat closes off, you breathe shallowly, and there's a couple of things you can do, like if you can give them a drink and say, hey, take a couple sips for me. That can bring down even 30 or 40% is remarkable. Another thing you can do, if you can get them to slow their breathing, so you can say, hey, can you try a couple things with me? Get deep breath in through your nose, hold it for a couple of seconds, exhale. Doing that 3 times can remarkably bring down that stress response. And so there's these little tricks, I guess. It's also human nature, I think, to try to help someone. What do we say? Hey, breathe, right? Have a drink of water, have this blanket, here's some Kleenex. Those really, you can magnify your response a lot with those simple things. Then you want to reassure them, but not overpromise. Why don't you want to walk away after you've been sitting and dealing with that person? What would the problem there be? Any guesses? Yeah, and so if you do need to leave for some reason, you grab somebody else and have them sit there and say, okay, such and such is going to sit with you for a minute. I need to go do this, and then I'll be back. So you want to keep that constant thing. These are little things, but remember, the better this is done, it markedly lowers the chance of them having PTSD because they've been able to be reassured and grounded and know they're safe much sooner rather than spending a long time feeling like they're unsafe and unstabilized. That seems to be the clincher right there. Don't push someone to talk if they don't want to. Maybe they want to be silent. You don't want to push them and say, hey, what happened? Tell me what happened. If anything, you want to say something like, if you need to, like, hey, can you tell me your name, or such and such is here. Do you know them? Don't ask for too much information at once, and then again, don't insist that they share their stories. It's actually crucial that they share their stories, but they need to do it in their own time, in their own way, and to who they want to share it with. As far as supporting them compassionately, a lot of this is human nature. A lot of you will do this naturally. It's good to be reminded. What it really means is just comforting someone, helping them feel safe and calm, protect them from further harm, help them address basic needs. Are they hungry? Do they need a drink? Do they need a place to stay? How are they going to survive for the next 24 hours if the support system can't get there immediately? Recovery, and that can start as soon as you are having interactions with them, recovery is really going to accelerate once they're back in their support system. It requires adequate sleep and rest, which can be a challenge if you just had something rough happen. A lot of times there's sleep disturbances. Making sure there's nutrition. I've noticed a lot of times in funerals that I've been to, it's kind of a cultural thing, maybe a Utah or Western thing, that you have a big lunch at the church after a funeral, right? For a lot of people, immediate family members, that's the first time they've really had a meal in a few days, because they're so distracted and their appetite goes away. And so it's important to remind people even to do the simple things. If you can resume routines, this is especially vital with kids. Kids can actually snap into a routine and recover very quickly. So in disaster scenes, even if villages or towns have been destroyed, if kids can be organized and do things that seem like school or play or games, kids do a great job at bouncing back and being resilient, allowing them to process the experience, and if they have the ability to help others. One thing, a person that used to work here responded to the Haiti earthquakes years ago and said they found remarkable that people who had lost their homes or maybe had minor injuries showing up at aid stations to bring food or to help other people. Doing that action, even though it may be counterintuitive, also is very healing. And that's one of the best ways to process something, is to be of service where you're helping being part of the solution. As far as you as a responder, it's important to work under an organization if you can, if you're responding. If you're responding to a car accident or something at home, you're the first responder. But if it's an organized effort, if there's a disaster, it's good to be part of something like the MRC or CERT, because there's more protection there emotionally and physically. You'll be told to take a break. Maybe sometimes if you don't realize you've been working too long, you may be ordered off the scene to take a break, whereas on your own, you might overdo it. You want to be aware of any secondary trauma that you're feeling. There are guidelines you can find easily on that. Mental health care, you want to seek that if a couple things are going on. If you're in your natural support system and you feel like you're still having symptoms, and to me, it's if it's disrupting your ability to go to work or school, it's affecting your close relationships, your ability to enjoy life after a month or two, then it's a good time to consider, maybe I want to talk to a therapist for a couple sessions. A lot of employers offer an employee assistance program. Most therapists are trained in very short-term therapy. Sometimes it helps to sit down with a disinterested party, so to speak, or a third party to say, I'm really struggling, here's what's going on. Is this normal? What should I expect? That can actually be very, very effective if you're in that category. So just as a recap, it's not therapy. It has to do with look, listen, and link, making sure you take care of yourself. To close, I did want to, I passed out a magazine here. Our last issue was the emergency preparedness one that Mike and his crew, that's kind of their baby, and it was a great magazine. The one before that was this one that we sent out. But in this one, we have a story about a bear attack. There's a kid named Braden Lowry from Cedar City, who he and his wrestler buddies up in college, I think it was in, I can't remember, Wyoming or North Dakota. Anyway, this hit the news a couple of years ago. They were out looking for antlers, and two of them separated from the four-person group, were looking in some brush, and a grizzly bear charged. 0 reaction time, severely mauling a couple of them. The other two got them back to safety, and it's a remarkable story. Our boss said, now, what does a bear attack have to do with public health? Like, we need a hook. This is a cool local story, but the ending is making the point. At the end of that story, we have a little box there. It's a quote from Dr. Deborah Heaton, who's a PhD. She says that studies on emotional resiliency and recover after a traumatic event show that certain factors are likely to prevent PTSD from developing afterward. She did a study of the literature and found these things. If you have continuous contact with and support from important people in your life, that group of 4 guys, and you can see their picture there, they helped each other from minute 1. One actually jumped on the bear that was attacking his buddy. And all his wrestling moves in the world aren't going to help you with a grizzly bear. But he jumped on that bear, grabbed its ear, and tried to pull it away from his friend. Action would probably not be recommended if you want to survive a bear attack, but it shows the value of loyalty and friendship. I mean, there's the quote, to give up your life for a friend. He didn't think twice about it. Now, then the bear turned his attack on him, and he got the brunt of it. And then the first guy that was Braden, who was attacked, staggered off and found his two buddies. They came up fearing the worst, that the second friend had been killed, but they found him still alive. And then they all together made it down the mountain, flagged down a farmer. They were able to call 911 for one of their cell phones, so Lifeline was able to show up pretty quick. But they were very closely involved, saving each other, even getting to the ambulance, going to the hospital together. They said they were joking and laughing. I saw some pictures from this that are unpublishable, but they actually would joke as they were going down. One guy was saying, "Look at me, I'm all red." Anyway, there's that gallows humor, that joking with each other and feeling that I am safe with friends really minutes after it happened was an incredible benefit for those young men, rather than being alone and maybe trying to make your way out over hours or a couple days. So continuous contact with your support system, disclosing the trauma to loved ones. Close family and friends beats a room full of therapists anytime. Therapists can be useful, but most of the time it's going to be telling your story the way you want it to loved ones who are able to hear it. Identifying as a survivor as opposed to a victim. So Braden said, I still had a deer tag, and he'd recovered enough where he went out alone at night. He's one of those people that he loves the outdoors so much that he was able to do it and say, I felt a little spooked, but it was actually therapeutic for him. Up to this point, these boys did not actually undergo any formal therapy. Their therapy was getting back out with now this time he had a gun and the bear spray. In fact, there's a picture I saw of them, it's not in here, of the four of them hiking, and each one of them has a large caliber firearm and bear spray on their belt. So lesson learned, they're taking the right things, but he was able to get out really quickly and do the things he wanted and overcome that fear. Use of positive emotion and laughter. Sometimes we don't associate laughter with trauma, but any of you who worked in the emergency room or on rescue squads, there's certain jokes you use to actually survive the situation that general public might not appreciate, right? Finding positive meaning in the trauma. So this guy's an outdoorsman. So he said, look, I don't blame the bear. The bear wasn't evil. I was basically, in the bear's bathroom. He was climbing through some brush and saw a pile of bear scat there. And he said, oh, look, and turned to his friend to notify it. And then the bear was on him. So he said, I understand we're in the bear territory. We were in thick brush, very ill-advised. So he was able to put that in perspective and go back out and be in bear country again. In fact, I think this year, I think it's a group, it's a YouTube channel called Brave Outdoors is doing a documentary on them. They took them to Alaska and took them up close to grizzly bears in their habitat. And so you talk about exposure therapy, these guys were up for it. Yeah, Brave Wilderness, thank you. Helping others in their healing process. And so the boy that was hurt the worst, the other guy came to his hospital room and comforted them. The boys visited. They were already part of a wrestling team. So you can see where there's really strong bonds there on an athletic team, and they continue to stick close together. And then finally, holding the belief that you can manage your feelings and cope. That's the whole thing behind cognitive behavioral therapy. I believe that I can actually get better and think and feel things to overcome the negative instead of being a victim. So the point of that article is to bring to fact the emotional part of survival. Then the very next article is the most dangerous animals, where we take grizzly bears and wolves and lions and tigers can be scary, but your chance of dying from any wild animal is probably more due to a mosquito, is the little joke at the end of that article. So yeah, see, I'm part of the generation to grew up with all the nature horror movies. Remember seeing killer bees on TV? So I was convinced at any time that a swarm of killer bees could show up in my neighborhood and kill everyone. That was kind of like you grow up thinking that falling in quicksand is a likely thing to happen to you, but probably never will. Ants, army ants, yeah. Hollywood's done a great job of giving us traumas that don't even exist. Well, anyway, that kind of wraps things up. Are there any questions or comments?